to AJTV, home of plastic surgery. I am Dr. Martin Ajujo, a consultant plastic, reconstructive and aesthetic surgeon based at AJ Plastic Surgery Center. Welcome to another episode of Plastic Surgery One-on-One. We promise you that we're going to have this series with different topics. And you know the hot topics right now in Nairobi and in Kenya and the region maybe is gastric balloon, weight loss. You've seen different influencers, celebrities undergoing this procedure. So I just want to delve into the procedure, but from now a plastic surgeon's view. And with that, we're going to understand what happens during the procedure, what do you expect, and importantly, how are we going to fix that body once you've achieved your ideal weight. Yeah, no, dramatic weight loss comes with immense health benefits. And there are many ways of doing your weight loss. Either you do lifestyle modification, and this mainly involves input and exercise. Input means what are you taking in, what is your diet, what is your calorie intake, and what is the frequency of that. So there are many interventions within input, such as intermittent fasting, keto diet, and all that spectrum. So what you're doing, you're trying to actually control your input so that you achieve a desired weight or your caloric intake. Then there are those that focuses on now your activity, either you exercise, brisk walking, mountain climbing, regular gym or sports. So when you combine the two, input and exercise, that's what we call lifestyle modification. If that fails, or if you don't have time or means to do lifestyle, then there's the option of what we call bariatric procedures. And in bariatric procedures, it can either be surgical or non-surgical. And these days, you have advances whereby you have the now famous swallowable balloon, gastric balloon, that you swallow a pill filled with water, and then that reduces the volume of your stomach. With that, it means you have less intake, so you don't really have, you get early satiety, or you get filled up very early, and it reduces your intake overall. Then there's that I can say minimally invasive, whereby you swallow an endoscopic balloon. It means there's a pipe that is being introduced into your stomach, guided with a camera, places the balloon into the stomach, the right position, and then water is introduced to fill that balloon. Now, going deeper to be more invasive is now what we call laparoscopic procedures. Common is a sleeve. It means your stomach is, there's a tie or a sleeve around your stomach. Same principle, reduce the volume of your stomach, early satiety, then reduces intake. And then now there's a more dramatic one, which is bypass, where you bypass your stomach. Comes with its own complication and adaptability and post-operative care. But my topic today is not about discussing really this procedure, bariatric procedure, but what is the aftermath of all these non-surgical and surgical procedures. After you've done your bariatric procedure, then you have your massive weight loss to the range between 25 to all the way to 45 kilogram. Within 3, sometimes 6 months, it comes with consequences. One of the obvious consequences is skin sagging, because all that fat that was underneath your skin has really melted away, if I to say so. So you and your skin and your tissues lose elasticity because of the rapid and massive weight loss. And you get that skin develop into folds, and then within folds you have accumulation of moisture or water, and this can cause irritation, rashes, and even with friction, ulceration. So a patient that has undergone massive weight loss and has excess skin and tissue that are sagging would eventually end up to a plastic surgeon in our hands, and we have to intervene. And there are several procedures that we're going to do. Body contouring after massive weight loss procedures vary, and it's not a cut and paste issue. Every individual will have different set or combination of procedure depending on where the fat was and the extent of sagging, the skin and tissue sagging. Procedure from head, you have sagging of the facial, wrinkling around the face, so you'll have some facial procedure. Then you go to the arm, there'll be a lot of skin sagging, especially if the arm was big and then you have loose skin. So you have to do brachioplasty. And the body, what you call the trunk procedure, it can either be in front, what you call anterior, so you just do a tummy tuck with a bit of plication or not, or it could be the body but all round, so you have to do either lower body lift or upper body lift. And the last one is the thighs, because once you lose, when someone has lost their weight, especially around the inner thigh, the outer thigh, then you have to do what we call a thigh lift. And this procedure usually combined or done one or two. I recommend you to do either maximum of 2 procedures in a sitting. Maybe you can do arms and breast, but for you to do all those procedures, going to be too taxing for the body. So I'd like to start by discussing the facial procedures, and I can tell you it can be as dramatic as a facelift to as small procedures, maybe eyelid surgery. So we do facelift, eyelid blepharoplasty. You can do a bit of fillers on the cheek, because when you lose your fat pads, the eye, the cheek, the lips, and even around your jaw, there usually are some fat pads. During the massive weight loss, because of whatever intervention you've done, you lose those fat pads, and the fat pads is what give your body or your face the contour and the curvatures. So as part of our body contouring procedure after massive weight loss, we have to do fillers most of the time around the cheek area. In some extent, we have to do a cheek implant, either a silicone cheek implant, but in a few patients, just Botox and filler will do the trick. Down the neck, we'll have a double chin. A double chin can either be treated by non-surgically. We have to do the injection called Kybella. We do a bit of injection, 3 to 4 sessions every 2 weeks. Can sort that double chin. If that doesn't work, we might be forced to do a bit of liposuction of the cheek, or do a thread lift, and in severe extent, just an entire neck lift, which involves getting rid of excess skin. When you move to the arm, because you have excess skin, you don't have fat. In this instance, you're not just going to get away with a simple liposuction like in a normal population. So you have to do blepharoplasty. I mean, get rid of excess skin, tuck, and do contouring so that you have an ideal and good-looking arm. Moving out to the chest, for our female patients, even in male patients, we have to do either breast lifts with a bit getting rid of excess skin, and for male patients who have undergone massive weight loss, most of the time you find that they have residual gynecomastia. So you have to do your the normal excision of man boobs, getting rid of man boobs. If you look at the link here below, you see a number of procedures to describe how to get rid of man boobs. Going down the tummy, which also is really affected, because when you gain weight, most of the fat is usually around the tummy and the flanks. So after intervention and then massive weight loss, you have to tuck. You have to do your tummy, either standard abdominoplasty, sometimes extended abdominoplasty, or entire lower body lift. If you go to the back, you might find redundant skin tissue at the back. Where the fat was, you have sagging skin, then you have to do a back lift. And lastly, for thighs, you have to do your thigh lift. And unfortunately for thigh lift, because of where your incision is and the groin area, the skin is usually very thin, and your thigh lift might take long than expected to heal. And that's why I would advise, well, if you are to pick out to do a group of procedures during body contouring after massive weight loss, then you have to do your thigh as the last procedure. So my advice to viewers is that as you are thinking of a weight loss procedure or a weight loss journey, at the back of your mind, think what comes at the end of that journey. because when you embark on a journey, you usually think of the destination. And for your destination here is weight loss. But for me, for you to think is, what is beyond weight loss? What will your body look after you've achieved your ideal weight? Because you can deal with your weight loss, be healthy, but then your mind is not healthy because you have that excess skin that's bothering you. You have that sagging breast, you have that inner thighs, excess folds. And this solution for that, so that you don't stop at lean body that you're not happy with. So I'd encourage you to always have it in your mind, discuss with your practitioners who is rolling you into a weight loss program of what happened after your massive weight loss. Thank you. Thank you for tuning in into AJTV. This has been Plastic Surgery 101. We endeavor to educate, demystify, and propagate the gospel of plastic surgery. Until next time, bye.